A disorder called selective mutism causes children to become afraid and mute in certain situations. Selective mutism is a complicated childhood anxiety disorder. It is extremely rare, and less than 1% of people with mental health issues have it. In social situations, such as school or birthday parties, a child with selective mutism may be mute, or they may only be able to talk at a whisper with a few other children. But at home or in settings where they're comfortable, they're little chatterboxes. Records of selective mutism can be found in medical journals dating back to the 1960s. Then in 1980, it was put in the Diagnostic and Statistical Manual of Mental Disorders, Volume 3. It was put in under the name elective mutism. At the time, they thought that children refused to talk in certain situations, when in fact they were so afraid that they could not speak. This disorder was basically ignored until 1991, when the Selective Mutism Foundation was formed. They replaced all the false theories with sound facts, and renamed it selective mutism. In the current volume of the DSM, the correct facts and treatments are available for professionals to reference. There is no test to diagnose selective mutism. The diagnosis is based off the patient's history with the symptoms and behavioral patterns. If a child is showing symptoms for at least 1 month, and that's not the first month of school, but any other month, then they should be checked for selective mutism. The symptoms are a consistent failure to speak in social situations, but are perfectly fine with speaking in other situations. Not speaking interferes with school and social interaction. It is not a communication disorder like stuttering, and the child must be comfortable with the language that they're speaking. Children may be excessively shy, have anxiety, fear social embarrassment, and exclude themselves from social interaction. In the diagnosis, a physician, a speak-language pathologist, and a psychologist look at education history, hearing ability, and look at the motor functions of the mouth to make sure it's all working properly. They interview parents and caregivers and evaluate the child's speech and language. Selective mutism is caused by anxiety disorders and self-esteem issues and self-image issues, and they also have a genetic predisposition to anxiety. These children usually have temperamental inhibition. This means they have a decreased threshold of excitability in their amygdala. The amygdala sends and receives signals of potential danger, prepares the body to fight or flight, basically. And because the threshold is so low in these kids, things like birthday parties and school are scary. They also can have physical symptoms like nausea and headaches, and stomach aches and diarrhea, chest pain, joint pains, shortness of breath, and nervous and scared feelings. It also causes emotional stress because as they get older, kids become less accepting of the kid that never talks. Some children with selective mutism have developmental delays, like pervasive developmental disorder, Asperger's, and autism. Children with selective mutism are diagnosed between the ages of 3 and 8, though the symptoms do start appearing when they're infants, but people just think they're shy babies. It's important to find a physician who really understands selective mutism so the child is not misdiagnosed. If the parents are told that the child will just grow out of it, that is extremely damaging to the child because they won't just grow out of it without help. It might actually get worse and the child could go totally mute. The earlier that it gets treated, the earlier that the child will be able to talk in social situations. Parents need to be understanding, and they need to tell their kids that they understand that they might be scared to talk and that they want to help them through it. Selective mutism can be treated with behavior therapy and controlled exposure to social situations. It can also be treated with medicine. Not all children who have selective mutism need to be on medication, but about 1/3 of them do. They're put onto antidepressants. The treatment can work right away, or it can take up to 2 years to really take effect, and then they have yearly checkups after that. Children cannot grow out of it on their own, but with help and with treatment they can. There are support groups all over for families who have a child with selective mutism. In the description below, there are links to learn more about selective mutism and to donate to research. Be sure to check out my other awareness videos, and I will see you guys in the next video.